Y'all, if your cough and cold medicine has 6 ingredients in it and you only have 2 symptoms, you are not treating your cold. You are treating marketing. And let me tell you, these marketing departments at these companies are gassing you up with all this severe and maximum strength and ultra max because you have a regular cold and it is treatable with the right ingredients. So please don't let them come for your pockets and your sanity with all the marketing. Welcome back to my channel. My name is Dr. Wallace-Gay. I am a pharmacist. I am the community's pharmacist. And here on my channel, I make medications make sense so that you can move forward with confidence and clarity and not confusion. And in today's video, we are breaking down cough and cold season medication, what works, what doesn't work, and what's safe for your health conditions. And also the biggest thing is how to pick only what you need without wasting your money or without hurting your blood pressure or your blood sugar or your liver. So let's get into it. So let's start off with why picking an OTC cough and cold medication is so hard. A lot of people struggle with the cough and cold aisle. It's overwhelming. There are so many boxes, so many colors, so many buzzwords like severe and nighttime and extra strength and mucus relief and all in one. I mean, it's too much. So the second thing to think about is the tricks on the labels. Like these brands will take the same ingredient and mix it up like 3 different ways. And they make you think that you need all of them when you really don't. And then number 3, ingredient confusion. A lot of products have the same 4 or 5 ingredients, just arranged a little bit differently. So like things like Dayquil, NyQuil, Tylenol Cold, Theraflu, same ingredients. They just have on different outfits. They're just packaged a little bit differently. And then number 4, when you feel sick, you automatically think, I must be severe. It must be the worst ever. No, ma'am. No, sir. You are regular. You just need the right thing, not all the things. So let's dive into the right things and what the ingredients are. All right. So I want you to match your symptoms to an ingredient so that you actually buy what you need and not have a bunch of other ingredients or other medications in there. So let's first talk about cough. And think about if your cough is dry or if it's wet. And I just had this conversation with a really close friend recently because she has a dry cough that she can't get rid of. And she said it was wet, but that's resolved. And she was using the right medication for that. And now it's dry. So my first thing was just like framing her mindset. That dry cough is probably going to linger for a little bit, 7 days, a couple of weeks, depending on the person, but it's going to linger. So if you have a dry cough and you just want to suppress it while your body is kind of getting through that, you can try a cough suppressant. This is something like dextromethorphan. So if you see any products that have DM on it, that means that they have dextromethorphan in it. And this is the medication that quiets your cough reflex so that you're not coughing all night and just, causing yourself to lose sleep, or so that you're not in a room with people and they all think something's wrong with you because you can't stop coughing when really you just have a lingering cough, but you're not contagious or anything like that. So some brand examples of this are things like Dosum or Robitussin DM. Also, NyQuil and Dayquil severe blends have dextromethorphan in it. Some side effects to watch out for. There may be some drowsiness or lightheadedness associated with them. And yes, some people may misuse dextromethorphan. So keep this away from kids and teenagers so that they're not doing things with it that they shouldn't be. All right. And then you may have a wet kind of chesty cough. So in this case, we don't want to suppress the cough and we don't want to use a cough suppressant because we want to be able to cough that mucus up, cough that phlegm up and get it out, or at least loosen it up enough so that you can swallow it. It gets in your gut. It goes out through your poop. So the medication that we use for that is called guaifenesin. So guaifenesin is going to thin the mucus so that you can actually get it out of your body. And so some examples of this are brand names Mucinex, Robitussin mucus relief, things like that. And let me be clear, you do not have to use the branded product. I'm just giving you some examples of brand because I know that those are the things that people are used to hearing. But right next to that branded product is going to be the store version of the product. That should work just fine. So back to guaifenesin. This is only going to work well if you drink plenty of water. So more than a bottle, more than 2 bottles. Like drink plenty of water. And it is literally designed to pull water into your mucus to loosen it up so that you can actually cough it out or get it out through your gut. So just to recap, dextromethorphan is going to quiet the cough reflex, whereas guaifenesin is going to loosen up the gunk, but you want to be able to keep coughing so that you can get it out. They are not the same. One is going to get rid of your cough. The other one is going to help you loosen up the gunk so that you can get it out, by using your cough as a benefit. And then once you've gotten it all out and your cough is kind of dry, then you can switch over to the dextromethorphan. Okay, another symptom that people have during cough and cold season is stuffy nose or nasal congestion. So let's talk about the infamous stuffy nose. Pseudoephedrine is the main decongestant that we use. Sudafed is a brand name for that, and the real version of this is going to be behind the counter. So you're going to have to ask your pharmacist for it. We keep track of how much people are actually purchasing because, as you may know, now I have a little bit of a sniffle. As you may know, this medication has been misused before. So this is the only true oral decongestion. It's really the only one. It actually shrinks swollen blood vessels inside your nose so that you can actually breathe. So some pros to this is that it works really well. It's great for sinus pressure. However, it can raise the blood pressure, so be cautious of that. It can raise the heart rate because there's some stimulatory effects to it. It can make you a little jittery. And also, of course, you have to show your ID to get it, so it can be a bit of a nuisance. There's another decongestant called phenylephrine. Now, a phenylephrine, this is the one that's out on the shelf. You don't have to actually ask the pharmacist for it behind the counter. Now, the FDA has literally come out and said, and this has been a little while ago at this point, that when taken by mouth, phenylephrine pretty much does not do anything. So you may still see some of it in the stores, but don't be fooled by the box. Phenylephrine looks good on the shelf. It's going to be in some of the products still, but it is not giving what it's supposed to give. So if you're someone and you feel like you've used products and phenylephrine has worked wonderful for you, sure, try it again. But I will tell you that we have the data that shows us that it really doesn't do much. All right, the next symptom is runny nose, drippy nose, also sneezing. And these symptoms need something like an antihistamine or something to dry things up. So some of the first generation antihistamines, the older ones, the OGs that came out, these are really strong. They're also really sedating, so they make you very drowsy, but they work very well. So they're going to make you sleepy, but they're going to get rid of that runny nose. They're going to dry you up really well. These are things like diphenhydramine, which a branded product is Benadryl. Works really fast. It's short-acting, but again, very sedating. Then you've got things like chlorpheniramine. This one is going to be in a lot of products that are marketed for cough and cold. Now, chlorpheniramine is one of the oldest antihistamines, and it works, again, for runny nose, for sneezing, and it works really well at night as well. It's long-acting, so you can take it and forget it. It's sedating, as I mentioned, and again, it's in a lot of combination products. And this is one that if you're someone who has decongestion and you have high blood pressure, products such as Chlorpheniramine HBP, which is a product for individuals who have high blood pressure that also have congestion, they will have chlorpheniramine in it. And that chlorpheniramine, of course, is serving its purpose as an antihistamine to help dry things up, but it's also helping a little bit with the congestion as well. So this is a way that someone with high blood pressure doesn't have to take a decongestant like pseudoephedrine, which will increase your blood pressure even more. And you can take something like chlorpheniramine, which will help with the decongestion, but also not raise your blood pressure. All right. Then we've got second generation antihistamines. So these are ones that you can use better during the day. They're not as drowsy. They may be marketed as non-drowsy or less drowsy. So these are things like cetirizine, which is Zyrtec, loratadine, which is Claritin, or fexofenadine, which is Allegra. And these products are more so used for individuals who have like seasonal allergies. But again, if you have a runny nose, or if you're sneezing, things like that, you can still use these antihistamines for the cough and cold season. And these, again, are going to be better just because they're not going to knock you out like diphenhydramine or chlorpheniramine. You're still going to be able to function during the day and get things done without having that runny nose. And then the final symptom I'll talk about is like fever or aches and chills. So if you're having any of that, acetaminophen is going to be one of the main things we go to. It's obviously great for fever. It's also great for aches. It's safe if you have high blood pressure. But if you are already taking acetaminophen in other products, like your pain med that you have at home, or if you're just taking acetaminophen or Tylenol for pain in general, you have to watch out for your liver to make sure that you're not overdoing it with acetaminophen in too many products. We also have NSAIDs like ibuprofen or naproxen, which are things like Advil and Aleve. And so you'll see the generic ingredient ibuprofen and naproxen in some of these cough and cold medications. Now, these aren't going to help as much with the fever, although they'll market it that way. And they do help a little bit with fever, but they are really great for inflammation. You just want to avoid these if you have kidney disease, if you've already got some stomach ulcer issues, or if you are late in your pregnancy. Just be really cautious about using these. Now, I already mentioned about acetaminophen being in other products, but also beware of your NSAIDs, because while we're not going to see as many combo products with the NSAIDs, we do have multiple medications that are doing things or acting on the kidneys. NSAIDs act on the kidneys. A lot of people's blood pressure medications and diuretics do things that affect the kidneys. So you don't want to overwhelm the kidneys and cause them to have an acute or sudden injury that could land you in the hospital. So still, you want to be safe with any of the pain medications and make sure that you're taking the right amount for you and that you're not overdoing it when it comes to treating your cough and cold and the pain that may come along with that. Now, a couple of other tidbits I've kind of alluded to, but if you have diabetes or high blood pressure, definitely be cautious when you're on the aisles in the pharmacy. So if you have diabetes, avoid sugary syrups. There are some that say sugar-free, so you want to try to go for those when possible. And if you can't go for one of those for one reason or another, just limit how much you're using and make sure that you're checking your blood sugar throughout the process. And if you can get a tablet or a capsule, that's even better if you can just stay away from the syrups altogether. Now, if you have high blood pressure, again, avoid pseudoephedrine, avoid phenylephrine, because although it's not doing much for your congestion, it's still having some of the same effects physiologically, so it can still raise your blood pressure. So be careful if you're using that one. And then you could go to something like a Courcine and HBP, which has chlorpheniramine in it instead of one of the decongestants. Or you could also use any of the other antihistamines. You can also just use your tried and true non-drug things like saline nasal sprays, humidifiers, teas. There are other things that can be used to help with that congestion. All right. Now, the final thing I'll mention is brand versus generic. And I've already kind of talked about this as well. But some of the big brand names, like, for example, you've got NyQuil, which has acetaminophen in it. It also has dextromethorphan in it for the cough, and it has doxylamine in it, which is an antihistamine. So it works very much so like diphenhydramine, and that's what's going to help you sleep. And then you've got Dayquil, which has acetaminophen in it, dextromethorphan, but instead of doxylamine, it's got phenylephrine in it. And we've already talked about how phenylephrine doesn't work as well, but that's what's in it. And then you've got things like Tylenol Cold. It's mostly acetaminophen, but it's got either sometimes an antihistamine in it or sometimes it's got dextromethorphan in it. So just, again, keep a watch on that. But it's basically acetaminophen, and they've got a small dose of some type of thing that might help with your cold, but it depends on what symptom you have. So I guess my point in all of this is that it's usually the same core ingredients. The companies just mix and match them differently in their branded products. So you are not obligated to buy the fancy brand. The generics are going to work just the same. So I want you to go into the pharmacy and feel like you can shop like a pro. When you hit the cold aisle, here's what you need to do. First, think about what your symptoms are. Flip the box over, find the active ingredients, and match one ingredient to one symptom. If the box has more ingredients in it than you have symptoms, put it back. That's not the product for you. If you start to feel overwhelmed, ask the pharmacist to come out and help you. Do not fall for the severe unless your symptoms truly match. And oftentimes that severe just means that the dose is a little bit higher, or that product has multiple different medications in it to hit, different parts of your cold. When in doubt, again, ask your pharmacist. You do not need the whole pharmacy to get over a cold. You just need the right ingredient for the right symptom. So I hope this helps. If so, share this with a friend. Let them know. And I hope y'all do well through this cough and cold season.